Hi, I'm Dr. Bill Cushing, and in today's video, it's a short video, I'd like to introduce you to HIPAA and HITECH. These are two pieces of legislation that impact the medical practice significantly. I'm sure you've heard of them. One example is a Massachusetts physician group practice, which ended up paying or agreeing to pay the U.S. government a fine of $150,000 when an unencrypted USB drive with patient medical records on it was stolen from an employee's car. A hit of $150,000 can take down some medical practices completely. Now, there are other stories of much larger fines for HIPAA violations. Much larger. Willful negligence can result in a $10,000 fine for each violation. If the negligence continues, the fine may increase to $50,000 for each violation. HIPAA violations can be expensive. As a physician transmitting protected health information electronically, you have significant exposure. So, what are HIPAA and HITECH? HIPAA, the Health Insurance Portability and Accountability Act of 1996, was created to protect patients' health information. It also created standards for electronic transmission of healthcare transactions, addressed the ability that workers could maintain healthcare coverage when they changed or lost their jobs, and amped up the fight against healthcare fraud and abuse. HITECH, the Health Information Technology for Economic and Clinical Health Act, was passed in 2009 as part of the 2009 stimulus package. The act promoted the meaningful use of health information technology. It knowingly and aggressively pushed the forced adoption of poorly designed electronic health record systems to medical practices. So who is required to follow the dictates of HIPAA and HITECH? Covered entities. And who are they? They are health plans, healthcare clearinghouses, and healthcare providers. A healthcare insurer falls under the term healthcare plan. A clearinghouse is an entity that processes transactions for providers or healthcare plans. A covered entity is obligated to adhere to the rules initiated by these laws. Another term you will hear is business associate. These are organizations that provide services to covered entities. They can be lawyers, accountants, medical billing companies, etc. They are also obligated to adhere to the rules initiated by HIPAA and HITECH. The HIPAA privacy rule requires that covered entities, 1, have a set of policies and procedures that protect the privacy of a patient's information. 2, trains its employees on these policies and procedures. 3, appoints an individual who is responsible for overseeing the implementation and control of these policies and procedures. And 4, notifies patients about their privacy rights. Now, we will go into HIPAA and HITECH in more detail in future videos, but I just thought it necessary to give you a basic overview of them now. But remember, the key is cash flow. A HIPAA fine can result in significant negative cash flow. Well, I hope this helps. Have a good day.